Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over 9 very common treatments that's not effective for plantar fasciitis. But before I do that, we need to understand the normal healing cycle so it will make sense why those treatments are not effective. So I'm gonna use external paper cut for visualization to understand the normal healing cycle, but the same process happens internally with the plantar fasciitis. But we cannot see it because the skin covers it. So the first stage of healing is the inflammation stage, which you start to have swelling, redness, the blood starts to rush to that area and experience pain. By definition, anything end with itis is inflammation. So you start to have inflammation. When you have plantar fasciitis, you probably have micro tear in the plantar fascia, as you see it here. That's a common location for it. And you see that redness, that's the inflammation. So after the inflammation stage, your body has to go through the proliferation stage in order to heal. That's when your body starts to build fibrotic tissue. Fibrotic tissue is like the glue that glued the torn tissue or micro tear. So if your body does not build enough fibrotic tissue, that tear will be permanent. So we need that. That's part of our survival. During the proliferation stage, you start to experience fascial restriction, fibrotic tissue, and you start to have muscle spasm. Perfect scenario, actually, during the maturation stage, your body should get rid of everything that occur in the proliferation stage and the inflammation stage. Because you're still experiencing pain, there's very high chance your body going back and forth between the inflammation and proliferation stage. So you have swelling, you have fibrotic tissue, it's very common. And when I palpate and work on my patient, I feel a lot of fibrotic tissue here. That's usually happened from the strain of the plantar fascia. So if you don't address the inflammation or the proliferation stage, the treatment is temporary and will not address the root cause of the problem, and you will continue experiencing pain. So when we look at the very common treatments for plantar fasciitis, it's common to use like heat and stim or ice. And based on the study, electrical stimulation to provide temporary pain relief. But when we look at the inflammation and proliferation stage, it's not going to do much to an inflammation or proliferation. Ice temporarily decrease inflammation, but it's not a long term. The other common treatment, foam roller massage, it's basically rubbing on the tissue. And the problem with that, if you have inflamed area here, and you keep rubbing it, you will inflame it more, which can cause more scar tissue. But the foam roller and the massage are not targeting addressing the fibrotic tissue, the scar tissue, the fascial restrictions. The other common treatment, acupuncture or dry needle, which is basically using needles around this area, but it's not gonna address the inflammation stage. You don't have mechanical force to address the proliferation stage, the fibrotic tissue, the fascial restrictions in those areas. The other thing that's commonly used, joint mobilization, which is basically like moving the joint back and forth. But the problem is the soft tissue. It's not a joint problem. So it's basically treating something different than the problem. And based on the study, it provides temporary pain relief, and some study actually does not even noticing temporary pain relief with joint mobilization. The other common treatment, and you probably see a lot of YouTube video on it, is stretching, which actually I recommend not to do stretching because based on the studies, stretching causes more inflammation, and if you overstretch, you're going to cause micro tear. So think about this way. Our muscle should act like a rubber band. When contract and relax, stretch like this. So when you have a micro tear in the plantar fascia and you excessively stretch it, you're going to tear it more. And the study shows it causes more inflammation. So it does not make sense the treatment will cause more inflammation because we want to decrease the inflammation. And I actually have a lot of patients when they start to do stretching, actually the symptoms get worse, which make a lot of sense. That's why I don't recommend stretching for my patient. The other common treatment that use is strengthening exercises. Strengthening exercises, if you use it during the inflammation stage, you're going to inflame it more. But much more important than strengthening exercises is addressing the inflammation, releasing the issues that occur during the proliferation stage, and doing biomechanic training. Because a lot of the time, and I personally had plantar fasciitis before, and I treated myself. That was like over 10 years ago. And the problem with plantar fasciitis, you will have a lot of like an anatomical anomaly, which mean it either you probably will have pronated foot or excessive supinated foot or bad shoes or bad biomechanic when you walk. And the right and the main thing is to address the problem with the triggers that actually cause it, instead of like just doing stretches or strengthening exercises and not addressing the inflammation and proliferation stage. I will leave a link underneath this video for the 3 natural, powerful treatment for plantar fasciitis. We'll see you soon in the next video. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.